Welcome to Conversations on Care and happy Friday to all. Thank you for joining us. Conversations on Care is our Facebook talk show bringing together our healthcare partners, our clients and their families and caregivers. And our goal is to have topics that help families better understand and cope with aging parents and with chronic care needs. My name is Julie Collada, and I'm the founder and CEO of Open Arms Solutions. And Open Arms is a home care agency serving the Chicagoland area, focusing on inspired home care solutions for seniors with chronic conditions such as dementia, Parkinson's, and other movement disorders. It is truly our mission to help our families through this journey and to know that their loved one is living their very best life possible. As a reminder, if you find these dialogues helpful, please share these and like them and share them with your friends so that it can reach more people. And if you have a question or a topic you'd like to learn more about, please write them in the comments below. We love to see those. Well, with me today is Carly Pine. And Carly is a registered dietitian nutritionist. And our topic today is dysphagia and how it affects the elderly. Thanks for joining us, Carly.
Thanks for having me.
Let me just tell everyone a little bit about you. Carly is a registered dietitian nutritionist currently practicing at an outpatient mental health clinic where she specializes in working with adolescents who struggle with eating disorders. She's pursuing a master's degree at Rush University. She practiced in an ever-changing field with new research and innovation. Carly spent several weeks caring for elderly patients in critical care at Rush and 3 ICU units. She will share a bit of insight regarding dysphagia diagnosis as her grandfather developed the condition in his later years in life. Welcome. So great to have you. You mentioned in your bio that your grandfather developed dysphagia.
Mm-hmm.
Was that one of the inspirations that led you towards this career? Can you tell us a little bit about what caused you to? We always love to hear how people ended up in their field.
Yeah, absolutely. I have always had an interest in working in healthcare. I actually started out at the University of Illinois thinking I was going to go into nursing, which quickly changed to wanting to be a physician assistant. And then as watching the years of my grandfather decline with his neurodegenerative disease, I started to realize that he was having a very difficult time with consuming food, the actual inability to chew and swallow properly. So he had to go on to a different modified texture diet. So my interest in science and also the passion for nutrition and helping others kind of like came together. I switched my field of study at the University of Illinois and followed through with years of being mastered into a program at Rush, where I'm now a practicing registered dietitian.
That's wonderful, Carly. Thank you for sharing that.
Yeah.
So I think the most, at the very highest level, we're talking about dysphagia. Can you just give us what is it and who does it affect most often?
Absolutely. So dysphagia is the inability to chew or swallow normally. It interferes with the transfer of either liquid or solid foods from the oral cavity to the stomach. So swallowing is like a complex process. It involves more than 30 muscles and nerves. So along the way, with as our neurodegenerative diseases kind of like, they get worse over time. Some of those processes and the strength of those muscles and nerves have hard time contracting or working as properly. So the damage to the process and the coordination becomes a little bit more difficult. So dysphagia can really affect anyone who has had like a stroke, head trauma, individuals with dementia, cerebral palsy, multiple sclerosis, muscular dystrophy, and Parkinson's.
Okay, it's a wide group. Well, thank you for that explanation. I mean, are there other if people don't have one of those diseases, Carly, as people age, is it possible to develop it just because you're getting older?
Absolutely. Age plays a huge process in this. So while some individuals might be younger with some of these conditions and experience it early on, age absolutely plays a role. Some of again, that coordination, those muscles and nerves are, they're not working to their full capacity as they were once when, the individual was younger. So this can just develop in the average older individual as well.
So interesting to know. Did you say 20 different muscles are involved? In
30
different muscles.
Yeah, it's crazy.
That is that's really an interesting fact.
Absolutely.
Think about it. I'm swallowing right now. You would never imagine that, right?
Right.
There's so many things that when we're healthy, we just feel are simple and automatic. And, as these diseases progress, certainly my experience is more with our clients that have dementia or Parkinson's. Mm-hmm. And have some cognitive decline where dysphagia starts to become a significant, just in the coordination of doing what we all think is a simple task, but is a much more complex task. Mm-hmm. So you already talked about a little bit about who this condition affects. We talked about that already. Can we talk about some of the signs and symptoms of dysphagia?
Yeah, so not to say that you may automatically have dysphagia if you're experiencing these signs, but some telltale signs that you are having difficulty with swallowing might be pain while swallowing, the sensation of food getting stuck in the throat, drooling, hoarseness, heartburn, sensing a lump in the throat while you're swallowing. So more of just that dry feeling in general, regurgitation, and most importantly, and where dietitians can play a big role, is that unexpected weight loss or malnutrition.
Yeah, absolutely. Mm-hmm. So I know you have a graphic that you were hoping to show, and we have our technical team advising us that it went away. Do you want to show the whiteboard? Do you think that will help people understand it a little bit more?
You know what? I think actually I might be able to show it online. So let's give it a try.
Okay. All right.
Let's see. Are we able to see this?
You did it. Well done.
Awesome. So my hope with this graphic is that this can better explain the actual process of what is happening to those who have dysphagia and the difference of a normal swallow versus a swallow that is affected by dysphagia. So if we can look on the left of this picture, we see an individual, we have labeled the nasal cavity, mouth. Those are more so areas that maybe most people are familiar with. And then as we get deeper into the actual throat itself, we have different sort of body parts called the epiglottis, the larynx. Those are involved actually in the swallow, and I'll get to that in a second. And then most importantly, and where dysphagia actually plays a big role, is the trachea and the esophagus. So the trachea, as we can see, leads to the lungs, and then the esophagus leads to the stomach. So I'm not sure if any of the viewers or you, Julie, have ever heard oh, it went the wrong way or it went down the wrong pipe.
Yes.
So truly, that's actually what's happening. So as you can see in the left picture, the food is going down and the epiglottis blocks the passageway to the esophagus. So it's almost like a shield that's propelling food down the correct pipe. If we look on the right side of the picture, what we see and what's classified as dysphagia is that the epiglottis, through again time, age, through these neurodegenerative diseases, is not working as fast and efficiently as the picture on the left. So the epiglottis cannot 100% block the opening to the trachea. So some food is actually slipping into the trachea. Um, I'm sure when, you, Julie, and other viewers can relate, when this happens, automatically, we begin to cough. Um, we begin to say, like, I'm fine, I just need some water. So for the individual who's not affected with dysphagia, this might go away in a second, right? Like, we can drink some water, try to cough, and we'll be relieved of that feeling. However, the individual who this is happening frequently, with that food going down the wrong pipe into the trachea, can develop pneumonia, can aspirate, and these are very, very significant symptoms and everlasting effects that can have a very damaging effect on the individual. So that's kind of what this picture is really demonstrating. Is
Right.
it doesn't look like that big of a difference, but it truly is.
Yeah. Well, that's great. Great explanation. Um, Thank you for taking the time to do that. I know
Yeah.
there are some times where, well, let me ask you this, because at what point for family members that are, if they're caregivers or our caregivers that are listening, or anyone in our referral partners, at what point, how do you identify that there's something more going on than
Mhm.
what we all experience from time to time, right? Uh,
Yep.
Something went down the wrong way. It could be our own saliva, right? And you choke or you cough, rather.
Mhm.
So,
Mhm.
what are some of the? Can you give us some tips about? Oh, if this starts to happen, we really need to, we need to have our physician, or go to the hospital, or go to see our physician. What are those?
Absolutely. So I would say that, there's no, like I said earlier, telltale sign like, oh, I have dysphagia. I need to go to the emergency room or go to the hospital, right? Like, it's not like I broke a bone. So this is the only place I can go, a telltale sign. So what I would say is that if this, especially with the onset of a neurodegenerative disease, starts occurring, we can go to, I would suggest, a speech language pathologist. So, dietitians and speech language pathologists work very closely in the hospital. Speech language pathologists are trained on the ability to look at someone's swallow through a test. It's called a video fluoroscopic swallowing study,
Uh,
called the VFSS. And through that, food and drinks of multiple textures are mixed with barium, which is a solution that appears white in an X-ray. So I've actually had the pleasure through my internship at Rush to go shadow a speech language pathologist working with an individual who was going to be diagnosed with dysphagia. And what it is they will eat multiple or drink multiple different foods and fluids, and you can see as the food is going down their throat if some of that white solution, where the food or the liquid is going down the trachea, like I showed in that previous picture.
mhm.
So with the different textures and the frequency of which that food or solution is going down the trachea, then the combination of a speech language pathologist, a registered dietitian, and your physician can truly diagnose dysphagia.
Terrific. That's very helpful. And once it's diagnosed, then what?
So once it's diagnosed, this is really where my role as a registered dietitian comes in.
Okay.
So there are several different classifications of beverages and foods that can be consumed according to your severity of the condition. So beverages range from thin liquids, like our typical water, milk, tea, coffee, juice, to extremely thick liquids on a scale of 0 to 4. That the rating of the 4 liquid is such a thick liquid, it actually needs to be eaten with a spoon. So obviously the range is pretty significant. And similarly with foods, there are liquidized foods like broths and soups, again, like we have to eat with the spoon, to all the way to like regular, easy to chew. We're using all of our muscles and nerves, like we talked about before, like bread or like a cracker per se. So again, there's a multiple range of food items that can be in that scale. So your registered dietitian and speech language pathologist kind of given like what they're examining from the swallow study, are we aspirating on different types of textures, can give you that scale rating of which type of food or beverage is most appropriate for you. So it's quite niche, and I think it's difficult at first to get adjusted to those textures. And I can tell you from personal experience, I saw that with my grandfather, as he was declining through his dysphagia experience. Going from water to almost like a gel form of water was quite difficult, but it increased his longevity and life because he was able to eat and drink properly.
So, am I understanding correctly that um, the thicker the liquid, the easier it is for someone with dysphagia to swallow appropriately? Is that correct?
Absolutely. So more so when we're maybe first diagnosed with dysphagia, we'll start with some of those like thicker or thinner liquids because our body is still able to swallow and get used to them. But as our progression of the disease, or as our disease progresses, what we're seeing is that the thicker liquids take a longer transit time from your mouth down your whole esophagus. So that gives the epiglottis more time to close efficiently over the trachea to prevent more of that aspiration.
Ah, okay. That's a very helpful explanation. I think that in our field, when we do assessments, there are times that someone's transitioning and needs more transitioning from the hospital or a skilled nursing facility or an assisted living community, and we're supporting that individual. Um, Sometimes there is a recommendation that our caregivers mix thickeners.
Mm-hmm.
Can you tell us a little bit about what thickeners are and at what point that is part of the process?
Absolutely. So, as in addition to the foods and beverages being at the correct texture modification, what we can do is add in dietary modifications. So let's say, for example, and I'll come back to my grandfather because I can easily talk about him,
Okay.
that he loved having coffee. He loved his black coffee, and coffee is a thin liquid. So near the end of his life, when he was unable to drink that coffee regularly, given the progression of his disease, his caretaker was able to mix a thickener, which can come in multiple forms, into the coffee to make it more of that gelatinous texture. So he was able to enjoy the flavor of the coffee in the textured form that was appropriate to him. So we can see that in addition with other dietary modifications, like this is important, and we haven't touched on it yet. I'm just too excited, but adding in like heavy cream or protein powders or other dietary modifications where people need to restore or gain weight appropriately. So as much as we can see thickeners as being a dietary modification, we can also see those increased caloric dietary modifications to make sure that patients and individuals, as they are in the thick of their disease, are still being able to restore and keep on that weight and muscle appropriately.
Sure. Um, that makes sense, right? I mean, because one of the things that I would imagine, well, let's make sure we talk about, I think you mentioned it, but when people are suffering from dysphagia, what are some of the signs and, what are some of the consequences, if you will, if it's not treated appropriately? What are some of the
Mhm.
things that we have to watch out for? Why
Yeah.
is it so important to see a nutritionist and to really assess this?
Yeah, so I'd say like the adverse risks of not following the proper diet or seeing, following up with someone like a speech language pathologist or a dietitian is that we might not be able to clear our airway. So if we are not eating or drinking the appropriate textures, we're at a very high increased risk of aspiration, which can turn into aspiration pneumonia. And the rates of length of stay in the hospital and even death rate from aspiration pneumonia is very high. So that's why it's very important to make sure that you are having the appropriate textures and getting the follow-up you need.
Yeah, absolutely. So tell us more about what a dietitian does and some of the things and how you help the senior population, some of the things that you see in in addition to this topic. What are some of the most important topics you see that are important for families to know or individuals as they age in their diets?
Yeah. Well, I'm going to start with like the first half of that question. So, other things that dietitians can do in this setting, especially like I saw during my time at the hospital. So, a lot of patients were laying in bed or eating in bed, like fully reclined and down in bed. And it's extremely appropriate, especially to make sure that we can elongate the length of our esophagus, that while we're eating, we need to sit up at a 90-degree angle. So this is extremely important. Nurses are well aware and well versed in this as well. And there's actually like an angle function on these like newer hospital beds where we can put them at a direct angle positioning. And then also to remain upright for 15 to 20 minutes after eating. So we can make sure that, again, those muscles and nerves have been damaged and are not working as efficiently as they once were. So if that swallow is taking longer, making sure that we can extend the duration of time that they are eating, and that they are sitting upright after eating to make sure that everything is passing through and getting into their stomach efficiently. So that's
That,
something that I was doing a lot of education on in the hospital.
oh my gosh, that's so important. And thank you so much for all of our caregivers and family members that are caregivers. That is such an important thing to know. What else?
Mhm. Additionally, minimizing distractions while eating. So, I personally, I eat with sometimes the TV on, or I'm on my phone as, social media or whatever I'm doing with work, and making sure that these patients are minimizing distractions, refraining from talking while food is in their mouth so that they can actually focus on the eating, the chewing and the swallowing efficiently. All of those play a huge role in this proper swallow.
Oh, it makes so much sense, and that's such important advice. So, what else should we think about in terms of um, what a nutritionist, dietitian, and this topic or others in terms of some of the things that you find are so important to help people as they age, stay healthy, and live their best life? What would you suggest?
So, I think dietitians, as I'm working in a completely different field, we are well versed throughout the entire healthcare, um, you know, all facilities, all different types of diseases. And what I would recommend, especially for our patients and our families who are going through these illnesses and the difficulty with the swallow in general, is to make sure that you do have a follow up or any visit with a dietitian who can monitor your muscle stores, making sure that we're not, at risk for malnutrition, which is very important, and increasing our longevity, making sure that our body can hold on to all the nutrients, the fuel, the macro, all the building blocks that are important for sustaining life. So I would say like the biggest takeaway is if you can follow up to do like a nutrition assessment, at least with a dietitian.
And is that assessment, I would imagine, just simply questions about what are you eating now? Is that
So yeah, so whether that's through questions, dietitians practice in the hospital doing what's called a NFPE, stands for Nutrition Focused Physical Assessment, where we actually get like hands-on with someone, assess like their orbital fat pads. We're looking at their triceps. We're assessing their legs and their calves for whether that's like edema or other sorts of ways that we're holding on to our protein and our fat. Looking at our rib cage, at what point is our ribs bulging? Can we see them? Looking at our clavicles, all different parts of our bodies that are holding on to either muscle or fat to determine, what more does this person need in their diet? What are they not getting now due to dysphagia, right? Like what other of these dietary modifications I was briefly talking about, like adding margarine or butter or avocado to their pureed meal, adding heavy cream to their thickened soup. So where can we put some more of those modifications in
Mhm.
to ultimately make sure that this person is still having an increased quality of life through what they're getting in orally and holding on to physically?
It's it's really interesting to know that you do the physical hands-on part of that.
Hmm.
In your practice, well, I would say in what we see, because we specialize in dementia care, are you familiar with, I'm sure you are, pocketing?
I actually am not sure. Can you explain
Well,
that to me?
sure, sure. When people have dementia, sometimes they, instead of swallowing because as the dementia progresses, their cognition declines,
Hmm.
um, their thought process declines. And so just like you
Sure.
would describe so well, how the complex nature of swallowing and all the muscles and coordination that are involved, when people progress with dementia, sometimes they don't finish their swallowing their food, and so they pocket their food. So they,
Mm-hmm.
instead of swallowing their food, they may chew it or they start to chew it, but then they just kind of just collects, like their cheeks get bigger,
Right.
which is a sign that they're pocketing their food. And then there's a
Hmm.
strategy to, help them by touching and massaging that area, kind of reminding them and cueing them, really is the right word.
Right.
That food is the next step, is to really, they need to swallow it. So I didn't know if that's something that you'd seen in your practice at this point.
Yeah, so I have not seen that personally, but that makes complete sense, right? Like
Yeah.
as our cognition is declining and that ability to swallow becomes harder over time, um, kind of like pocketing does make sense. So something that we do in our practice, which is eating disorder, so coming from a complete different world, but something that could also be utilized in this population are, I'm not sure if you're familiar with the drinks like Ensure,
Sure.
Kate Farm Solutions. So it's for the viewers who might not be aware, it's a nutrient dense packed beverage. They can come in regular Ensures, Ensure Maxes. They range from at least 220 calories, and they each have like nearly 20 grams of protein. So it's a great way in a small condensed beverage to get in a lot of nutrition. So some dietitians will also mix in the thickeners to these Ensure drinks, which is a great way to replace a snack, or we can add a couple and instead we can replace a meal. So individuals who I also worked with the hospital in the ICU units who had, oral cancers or different type of like ulcers or difficulty with chewing, were
Mhm.
able to drink these drinks, maybe not thickened, but still what I'm getting at, to restore that nutrition and make sure that they are getting in the caloric and protein and hydration goals that they need.
It's Yeah, that is such is people just get older and they don't their their desire to eat
Hmm.
wanes sometimes. I don't think that will be me, but for a lot of people, that you just really have to nurture them and really, continue to remind them that
Hmm.
to keep up their strength, they need to eat. So those are great solutions. Absolutely.
Yeah.
Well, we're really about out of time. We've about a minute left. Is there anything else that you feel that you wanted to share with the group about this
Um,
topic, or,
at this time, I would just say that, again, nutrition is so, so, so important, and our body needs energy every single day, whether we're actively moving, whether we're sedentary, to keep our minds going, to keep our body and our organs and all of our processes going. So, no matter what type of food, what thickener, what consistency it's at, doesn't make food less important and nutrition less important.
Thank you, Carly. The information is so important. I learned so much. I really didn't understand dysphagia. I didn't. So I certainly knew that that was something that affects a lot of our clients, but thank you for explaining it to everyone. That was wonderful.
Absolutely. It's my pleasure.
Thank you for being a guest. Wish you the best in your continued career.
Thank you. Thank you so much, Julie, and thank you to Open Arms for having me.
Absolutely. Take good care.
All right. Thanks. Goodbye.